everyone, and thank you for joining. Welcome to today's webinar, How Parents Experience Profound Autism, One Size Doesn't Fit All, sponsored by Catalight. I'm Chris Larson, reporter for Behavioral Health Business. I've been covering the healthcare sector since 2016. I'm excited to be moderating our conversation today. During this webinar, we'll discuss profound autism and intellectual disabilities, the diagnostic process, and how parents experience the diagnosis and navigate their child's care and needs afterward. We'll save 15 minutes at the end of today's webinar for audience Q&A, so please enter your questions into the Q&A window during the webinar. Our panel will answer as many as possible after our discussion. In the resources widget, you'll find any and all relevant downloadable assets, along with a post-webinar survey. Please take just 1 minute after our webinar to share your feedback on how we did. We greatly appreciate any and all insights. Also, for those tuning in live, please note that your audio has been muted. But again, if you have questions or comments, send them our way using the question function in the webinar platform. And if you miss anything, don't worry. This webinar will be available on demand on the BHB website under the webinar section. Joining us today are Catalight's Chief Clinical Officer, Doreen Samelson, and Jackie Kancir, Executive Director of the National Council on Severe Autism. Doreen, Jackie, can you tell us a little bit more about your background and roles? And Doreen, let's go ahead and start with you.
Thanks so much, Chris. So I, as Chris said, am the Chief Clinical Officer for Catalight. For those of you who don't know, Catalight's a large nonprofit. We served over 17,000 families last year, and I'm sure we will top more than 20,000 families this year. I am a licensed clinical psychologist by training, and I'm also the parent of a middle-aged adult who has significant developmental disabilities and ID, and I may talk a little bit more about that as we go along.
Awesome. And Jackie, why don't you go ahead and tell us a little bit about yourself?
Yeah, hi, I am Jackie Kancir, and I'm the Executive Director of the National Council on Severe Autism. Our mission is pursuing recognition, policy, and solutions for the surging population of families, caregivers, and individuals affected by severe forms of autism and related disorders. I'm also a parent, and my daughter has a rare disease called SYNGAP1, and with that, I am also the Patient Advocacy Director for the SYNGAP Research Fund.
Awesome. It's so great to have both of you guys here. So let's go ahead and dive in. First, let's talk a little bit more actually about your kiddos. You're both parents of adult children with significant developmental disabilities. Can you tell us just a little bit more about your children? Doreen, let's go ahead and start with you again, and then Jackie, why don't you follow up after that?
Yes, I'm happy to. So I always say, you know, a lot of what I learned as a psychologist may have come from books and seeing patients, but a lot of what I've learned has been by being my son's mother. My son has an intellectual disability. He has communication, but not really language. If you think about language as a complex form of communication, my son does not have language. He'd be considered minimally verbal. His verbal IQ is in the 40s. He's also profoundly deaf, which makes things a little bit more complicated. Interestingly, and this might come up as we talk about severe autism today, my son's adaptive skills are somewhat higher than you might expect given his language abilities and his communication abilities, which is actually a real plus. And we may talk more about adaptive behavior as we talk about profound autism, because adaptive behavior is really a very important part of profound autism. I'll turn it over to Jackie to hear about her daughter.
Yeah, hi. So my daughter Jaden is 21 years old now, and she does have profound autism. Her genetic identifier is SYNGAP1, but we didn't know that until she was 16. That kind of gave us our why. We had been collecting a lot of diagnoses over the years prior to that, including Lennox-Gastaut syndrome, which is a major seizure disorder. So there were a lot of challenges that we worked with early on in her years. She continually struggles to this day with adaptive behavior, as you had described. In the past few years, we have been working on treating catatonia, which seemed to come out of nowhere in her teen years. So Today, we are finally getting a handle on things, and she really loves the animals on the farm. She loves art, she loves baking, and she's really, truly just a lot of fun.
Awesome. And thanks so much for that background and for those insights. Helps us understand a little bit better where you guys are coming from, both as professionals, but also as people. Let's get a little more specific and granular a little bit. What is profound autism? How is it defined? How common is it? Doreen, can you get us started, please?
Yes, I'm happy to. So profound autism is a term that has something that we've been talking about more recently. Interestingly enough, if you go back in history and you think about the children that had the diagnosis of autism, like I met my first autistic child in 1982 in a severely handicapped classroom. And that child was diagnosed with autism and also intellectual disability. And intellectual disability often goes along with profound autism. It's not a diagnosis that we see in DSM-5. It may end up being a diagnostic label that we see in the future. I would not be surprised to see that. When we think about profound autism, we're really talking about people who have significant language problems and significant adaptive behavior problems. There was a Lancet article a couple of years ago that came out that talked about the importance of really looking at that adaptive behavior piece. The CDC has defined profound autism slightly different with more of a focus on IQ. But I think for a lot of us, as we work in the field, we're seeing more and more how important it is to look at that adaptive behavior piece. So we're really talking about people who are never going to be without 24/7 support, right? This is not going to be somebody who is going to be living in their own apartment or their own house. They're always going to need somebody there with them for different types of support. So people with profound autism and also people like my son with lower IQs, intellectual disability. And by the way, my son does not have the diagnosis of autism, although at the time he was a young child, we weren't diagnosing autism the same way we are now. So he might get that label now if he was evaluated. But my son's never going to live by himself, right? He's always going to need somebody there to support him in various different ways. And that really, I think, is one of the hallmarks of the group of people that we say have profound autism.
I gotcha. Now, Jackie, let's turn to you and talk about the experiences, a little bit more about the experiences of parents. Now, at what age is a child typically diagnosed with more severe or profound autism and or an intellectual developmental disability? And, you know, after we talk about age of diagnoses, what happens next?
Well, I'm not certain that there is a huge distinction between the ages as far as profound autism and intellectual disability versus other conditions or severity levels. But however, we do have science now that is indicating these changes occur as early as in the womb. And most recently, we look at the research that came out of the University of California on the organoids, and we see that it is this overabundance of neurons, and that process really starts in utero. And so when they get a diagnosis really varies based on their access to resources and those things. However, for me personally, I actually noticed that there was something different, something that needed greater attention when my daughter was only 8 weeks old. I had noticed she wasn't tracking objects with her eyes, and that now is commonplace that we know that that is an indicator for screening for autism. But as Doreen said, back then, it was very challenging to get any type of diagnosis, even well through toddlerhood. So things have progressed, and that is the good news. Parents do have access to diagnostic resources much sooner now.
I gotcha. Okay, so let's talk a little bit more about what the daily experiences of parents of these children look like. So, Doreen, what does a a typical day look like for a parent for someone who has significant developmental disability, like profound autism or other IDDs look like?
Mm-hmm. Well, I think, of course, it can differ family to family, but the main issue is because you have a child whose adaptive skills, right, their ability to communicate, their ability to do daily living skills, their ability to interact socially is really impaired. And we also have behaviors that often we have aggressive behaviors or self-harm behaviors that you really have a child that you're having to monitor and watch. You're not going to, just leave the house and go grocery shopping and come back home, even if your child is no longer a young child, because many times something might happen while you're gone. There could be some thing that really dangerous that happens while you're gone. So much of the parenting is really spending a lot of time monitoring, making sure your child is safe. Our kids are going to move in as adults. My son is in a living situation where he's got somebody there if he needs somebody 24/7, right? My son is a little bit more independent than some, but he cannot live on his own. He's not, so he needs that support. And now when you think about as your child becomes an adult, and maybe there's medical issues that come up, or my son is a middle-aged adult now, so he's aging like we all are. And so certain things come up, and my son doesn't understand why, he needs to take medication for hypertension, right? He doesn't understand what hypertension is. He doesn't understand what the medication is. And so as a parent, you're having to make those decisions and set up systems and supports for your child so that they can have the care that they need. And it means that there's a lot of stress often on the family system and the parents in that way. And I would love to hear what Jackie has to say about this as well.
Yeah, thank you, Doreen. Well, I can tell you every day is different for us. And the worst thing I could ever do is try to predict on a daily basis what my next day is going to be like. As an example, last week we were going to do our tech check, but I got a call from the school as I was heading out the door that my daughter was in crisis and I needed to go pick her up. And so I had to cancel on this last minute. And that element of unpredictability really is an overarching theme within our lives. That to say, at this stage of the game, I think that we've got a pretty good handle on the types of environments and interaction that she does the best with that really help support her the best. And so pending there isn't a medical event, such as if she has an infection or something else that would biologically change something for her, then in general, at home, supported by me with her chickens and her bunnies and her dogs and all the things that she loves in a safe environment that has elopement protections and all those things, she does really, really well and our lives are really peaceful. But if there's anything else in the environment that disrupts that, if there's new staffing and they don't understand her language, if there's, like I said, an infection of some sort, if there's noises that are unexpected, it can really get very intense very quickly. And so a lot of my days are spent, as far as the stress level, it is stressful, but it's not her that is stressful to me. It is the care coordination that is so complex and having to translate her to the rest of the world because of how often she is misunderstood. That is where the stress really lies for me.
It definitely sounds like there are many challenges, but great joy in being a caretaker and loved one to someone with an intellectual or developmental disability. But given you guys' professional and personal experiences, what do you feel optimistic about? And Doreen, why don't you go ahead and kick us off with this question?
Well, I think one of the things that I feel somewhat optimistic about is that people are talking about this population of people who really need intensive services. I'm concerned about those services being cut. I'm concerned about people really understanding what it means for somebody who doesn't understand the concept of money, for example. It doesn't understand how you have to be independent about money and somebody else has to handle that for you. I'm really concerned about the medical piece because my son is getting older now and he has developed some medical problems that are connected somewhat to age, like hypertension. And it's really important that his medical staff, the people that provide care for him, really understand him and can understand how to communicate with him. And I really resonated with what Jackie said, is like, we're sort of interpreting for everybody else. And so I'm hopeful that we're doing a webinar like this, that we're talking about this population, because I think this is the population of people that has not been really talked about. We might talk about the autistic person who's very bright, who's going to be a tech genius, who's going to do all these exciting things, but nobody is really thinking about the fairly large group of people who are really going to need this high level of care, but can have a high quality of well-being and quality of life with the right supports. And my son does have good quality of life, I believe.
I gotcha. Yeah. And Jackie, what do you think?
Yeah, absolutely. I think that the thing that has gotten me most excited over the past year or so is really seeing more integrated healthcare focus emerge. Of course, it's something we've been studying for a long time, but I'm seeing it more in application now, practice throughout more cities. And that is something that I think is really going to increase quality of life for this population. Because, for example, at one point, my daughter had 16 different specialists, and that was very taxing on her and us, all the different appointments. And how can you lead a normal life if you are constantly going to all these appointments? Versus if you could have that all under one roof, right? Or at least the majority, the main part of your care under one roof. And really seeing individuals as whole human beings instead of these fractured, siloed symptoms. And the approach that, of course, I love is the biopsychosocial approach, and just looking at how all of these things play together. And I think that is something that has really got me excited this past year or two, is just seeing more of that in the conversations around autism and intellectual disability and other developmental disorders.
Okay, good to know. And Jackie, we're going to stay with you for this next question. How have changes in advocacy improved things for today's parents who are receiving this diagnosis in their families?
Well, quite a bit. So I look back at when I started this journey many years ago, and nobody was talking about this back then. My daughter's early intervention therapists were the first ones to really push that they thought that she had autism. But as I said, it was very challenging to even get a diagnosis, let alone find another parent who also had a child with autism. And then once behaviors began to emerge, I had no idea that this was a thing, and that there were other families. And so there was such a lack of information at all, let alone quality information or lived experience. And that is so different today due to advocacy. We do have broad networks of really experienced parents. They are working in collaboration with professionals in the field that also have experience, and researchers trying to find more information. And so we just have such a bigger information highway now with with autism, and especially this side of the spectrum. And then when you look at, as far as a tangible access, you look at the work that New Jersey did. You know, advocates got together and they said these systems are so fractured, whether we're talking about, you know, the Department of Transportation and we need help over here, the Department of Health. And so the advocates got together, I think in 2016, 2017, and they created the Office of the Ombudsman. And now look at what Paul Aronson's being able to accomplish in New Jersey. And that is the power of advocacy. So I always tell parents, your voice really does matter. And we just need you to speak up and use it. But collectively, we really can make some really positive changes.
I gotcha. So definitely key insights there when it comes to advocacy. And I just want to follow up on what key areas of advocacy need to be focused on going into the future. And Doreen, let's go ahead and get your voice in here when it comes to the advocacy question.
Well, I think one of the things that we need to really work on, we've worked somewhat on services for young children, not that we're done, but there is early intervention services. My son didn't get that. It wasn't a thing at the time, but now we do have early intervention and it can be very helpful. But we have an aging population now. And so in the United States right now, about 75% of people with significant intellectual and developmental disabilities, including profound autism, are sitting at home with aging baby boomer parents. I'm a baby boomer, so, I can relate to this. And we've been very lucky that we've had our son in a program where he is in a residential program that is a good fit for him. There are not enough. My son was on a waiting list for some time. He's got a pushy mother, that helps. But, there's not enough services out there, right? And so we've got this aging population. And even the question in my mind, I think to myself, when my son is, a senior, when he's in, say in his 70s or 80s, would he be able to move into, any of the seniors services, that are available to other seniors, right? Or is there going to have to be some special kind of program for him when he's 80 years old? We don't have that set up. We don't have the work assistance. We don't have the employment assistance. We don't have the living services. We don't have any of that set up. His dad and I are aging, right? I mean, we now are starting to worry about what's going to happen when we're no longer around. That is something that we have not been paying enough attention to. In general, the intellectual and developmental disability population is living longer and aging like, many of us are, which is a positive thing. But then that means we need services. And I do worry about these kids that are aging out of school at 22, and then where are they going? What is happening to them? And so we really need to be paying attention to those services, and particularly paying attention to the services for the part of the population that does have those very low adaptive skills and has behaviors. Because, adult programs can just send your 40-year-old adult child home and say, we don't want him anymore. It's not like special education where, the federal government has said you have to provide a free and appropriate education. If you have a 40-year-old and they're in an adult day program and their behavior becomes very difficult, that the organization that runs that adult day program can simply exit them out of that program. And then what happens? So we don't have the same protection for adult children that we do for younger children.
I gotcha. So let's kind of shift the lens of the conversation just a little bit. So we've talked about the lived experience of parents and caregivers, both from your personal and professional viewpoints. And we've also talked about advocacy efforts. I want to see if there's anything else that we can talk about or learn about when it comes to what behavioral healthcare providers need to know. And I think we might have touched on something earlier that we could elaborate on when it came to integration. Behavioral health providers, be they independent or part of larger organizations, really stand well positioned with the know-how to maybe support both families and kids and people's children But what do you guys think that behavioral health providers need to know as part of this conversation?
Jackie, do you want to go first, and then I'll jump in?
Sure. Sure. This is definitely one of my passion topics, and really it came out of lived experience that it became so. I had a really amazing BCBA while my daughter was first emerging into catatonia, and she recognized that this was biologically based, and so she then switched gears to really becoming quite an advocate for my daughter and helping me be able to translate what was happening in our world to her physicians, and serving as kind of that center point for us, where she was collecting all of this data that was outstanding. And then as a provider herself, being able to go to the appointments with us and say, this is her medication schedule. This is what, we were tracking at this time, this happens. And I think that we need something to help us with impulse control. And so we might be in a psychiatry appointment and she would be talking about that. Other times she was talking with complex care, trying to help me advocate to get different tests run because we just didn't have enough information, and her data was showing that. And so it really showed me the power that ABA can provide on that consultative basis. And we just had a webinar by Lee Linder, and he has these behavior constellations that he has created that is very much on this practice of ABA working with families and physicians and kind of standing in that center ground. And I am really excited about that model being presented throughout more of the country.
So I'll jump in here. One of the things that I think in terms of medical providers and all providers really that interact with people with significant intellectual disabilities and profound autism is really understanding communication, what can be communicated, what is not going to be able to be communicated, how the person communicates. We had, our son had to have a test, an ultrasound test of his liver, and because he's at high risk for some liver issues. And it was up to us to, find the YouTube videos to show him, to practice, to do all the stuff, then to insist that his dad was there with him during the test, which at first they were like, no, normally somebody who's an adult goes in for a test like that by themselves, right? So it was up to us. And what I was lacking, I think, is I didn't hear the questions from the medical providers at that point. Like, how can we communicate with him? What's his best way to communicate? How can we tell if he's anxious or scared? Just some basic questions that a medical provider can ask that gives a lot of information that will allow them to interact with a person and allow the test to take place or whatever. In our case, it was a test. Thank goodness it came out good. It was negative, so that was really good. But my son is going to have this test periodically, and it was upon the parents to kind of educate the medical providers. What I think we need to do is spend more time teaching in medical school and nursing school and physical therapy school and pharmacy school and all those things about intellectual disability and profound autism. My son's sister is a physician, and she will tell you in medical school she didn't learn very much about any of it. What she understands about developmental disabilities is because she has a brother with a significant developmental disability, but she didn't get that in medical school. And so I think we have a lot that we need to do in terms of just educating, basic education on what is important in terms of communication, how you approach the person, who do you talk to find out more information. Often it's going to be the caregiver, a parent, or an older sibling. And we just don't do that kind of training very often, and we need to change that.
I gotcha. And Doreen, you touched on this a little bit already, but let's see if there's anything else that we can fill out and expand on. So how does individualized care play a role in helping families, and how is Catalight making the parenting experience easier for families with these diagnoses?
Yeah, well, we're doing a number of things. And one of the things that we believe in is giving families options. And so we do quite a bit of ABA. Many people might be aware of that. We do a lot of what we call paraprofessional mediated ABA or tiered ABA, sometimes called practitioner mediated. We also do caregiver led ABA or parent mediated ABA and other non-ABA behavioral health options, because we really do think that one size doesn't fit all. We really think that families need options, and often there's going to be a treatment plan that's going to involve more than one thing, right? It's not just one thing that's going to get the job done. So we really feel strongly about that. And we also feel strongly about everything rolling up to well-being. So my biggest concern for my son is not that he understands about money, for example, not that he understands that he can talk about politics or something like that, because he doesn't have the language to do any of those things, right? My biggest concern is that my son has good well-being, and everything, all the services that he has and the medical people that approach him, all the decisions that we need to make should roll up to well-being, for his well-being and also, family well-being. And that's, of course, particularly true when the person is still living with their family or they're younger. But if it's not going to improve well-being, then we're not going to do it. I think we need to get away from this idea of saying, we're going to keep trying to teach the same thing we've been trying to teach over and over again, that the person is not learning. They're probably never going to learn it. We need to say what will improve their well-being and what will improve the family's well-being. And I think when we can do that, then we're really talking about being able to offer that individual care, because what improves somebody's well-being is, individualized to a point. I mean, there's certain things that improve all our well-being, but a lot of those things are very individual. Jackie's daughter with her animals, that improves her well-being. Those chickens, the rabbits, I love that, by the way, Jackie. That improves their well-being. My son is a walker. He likes to walk. He walk. He's safe walking out in public, and he loves to walk. And walking is a big thing for him. And going on walks really improves his well-being. We have to find those things.
Yes.
Yeah, finding well-being is, it's a constant struggle and eternal quest for all of us, but it's especially relevant for this topic and for the people that we're talking about. Now, Jackie, I want to turn to you for this next question, and then Doreen, feel free to follow up. What 2 or 3 key pieces of advice would you give a parent whose child has just gotten a diagnosis, from your perspective, both as a parent and then also as an expert in the field?
2 things. One would be get connected. As I said, that wasn't an option for us 20 years ago, but it is today. And it is important to get connected with people, not necessarily inside of a very limited echo chamber, but people who can relate to the circumstances of your life, right? And so, for example, though my daughter has profound autism, I'm also in IDD groups, I'm in rare disease groups, and because despite there might be a difference in diagnosis, there is a similarity in the lives that we are living. There is that solidarity and that understanding, and that's really important to be able to get your information from those who are living similar circumstances as you. The second thing would be location matters. If I could go back in time and tell a younger me how important that is. Disability policy varies vastly state to state. Really do your research. If you have a young child that just has come down with any significant diagnosis, something that is going to be requiring 16 different specialists and lifelong specialty care in this, vast coordinated services and long-term care after you're gone, you want to do everything you possibly can to be in a state that is going to be able to provide those resources for you. And so location shouldn't matter, but it absolutely does with this population. Yes.
Doreen, what do you think?
Well, I think a lot of what Jackie said is very important, getting that support, educating yourself, but also, lots of times people say you have to do X. Well, maybe you do and maybe you don't. If X is going to work for your family and that's going to be the right way, that's fine. But I am bothered sometimes by, a certain diagnosis happens and people say you have to do this particular thing. Rather than really looking at what is going to be best for that family and that child. I also think that making, we always say this, and I know it sounds kind of trite, making time for yourself, but you do need to do that. And if you can have that respite time, it's really, really helpful. The other thing I will say that's very important, I feel quite strongly about this, and then I believe the National Council on Severe Autism is looking at siblings, and there's a sibling project, correct, Jackie? Making sure that we attend to the siblings. So here's what you don't want. Your everything and every minute of the day is focused on the child with the developmental disability. And then years later, when it comes, mom and dad are older and they, are no longer able to care for that person. And the siblings are like, you know what? My entire childhood was about Johnny and his autism and his ID. And I'm over it. I can't be there. I can't do that because I felt like my childhood was taken away. We have to make room for siblings and so that they can have a childhood too. That takes some intention. That's difficult. I mean, my husband and I had many conversations about that. And because we wanted to make sure that our daughter did have time to be a child too and have her own things. You don't want a situation where you say, well, you can't be on the soccer team and go to soccer practice because we're waiting for the ABA, the RBT to come over for ABA for your sister or your brother. So you can't do these other things. And that actually, by the way, is the problem with one of the problems with high hour ABA sometimes. So we need to make sure that we're looking at the whole family. And as a parent, it can be hard to do that when you've just gotten a diagnosis of one of your children, but you do need to try to make time for yourself. And if there are siblings, make sure that you have made room for those siblings to be kids and do the things that kids do. And the last thing I will say is, I really think, like I said before, my son has good well-being. So I want to give hope that things can be tough. And there were some years that were very difficult, particularly during adolescence, really some rough times, but you can have a good life. You can have well-being. Your child can have well-being. It won't be probably what you were imagining maybe was going to be the case, but it is possible. And, but you do need, that support around you to kind of make that happen.
Yeah, building up supports are absolutely vital. So one of the places that can establish supports for everybody is, within the advocacy world. We did touch on this earlier, but I do want to see if there's anything else that we can talk about or that needs to be talked about when it comes to the wider discourse around caring and supporting for people with disabilities. Is there enough of a focus on those specifically with IDDs in your guys' assessment? And Jackie, let's hear from you first.
No, honestly, there isn't. And I briefly touched on this in our article I did earlier this year for the Helen Journal, but right now we're in the process of reauthorizing the Autism Cares Act, and we're looking at $1.2 billion again to go to autism, and it is important, right? But a lot of times that money is not going to the debilitating nature of disability. And in addition to that, one problem with the focus on a solo diagnosis is that it completely excludes a lot of individuals who have intellectual disability, who have very low adaptive functioning, but don't have an autism diagnosis. And yet they may need significantly higher levels of care than other individuals who maybe do have an autism diagnosis but don't need that level of care. So I look at the equity in all of this, and it really is something that is very disturbing to me. So no, we are not focusing enough on the adaptive functioning element. When we look at, regardless of what your diagnosis is, whether it is autism, you have a rare disease, you have intellectual disability, it's unknown. You're still looking for your why. We really need to simplify this and get down to, what is your adaptive functioning? What level of supports does this person need? Do they have the resources available to them? Can they access a physician that will treat them? Or are they somebody who has intellectual disability or profound autism as an adult and is waiting 8 months to find the one dentist in the entire state that can treat them? And in the interim, they're having all of these intense behaviors that nobody will treat that either, because they are in so much pain but don't have access to basic health care, right? So the disparities that these populations face at this very low adaptive functioning is really indescribable, and we're not talking enough about how marginalized this population is across diagnoses.
And if I can just, Chris, add something really quick. I think, in terms of advocacy, we want people with IDDs who can speak for themselves to speak up and say, this is what I need, and share their experiences. What we don't want is those who do not have the language to tell us what it is they want and need to be left out of the conversation. And that has been happening because, when somebody doesn't have that language and their adaptive behavior is very low, they aren't able to explain those things because they don't have the language to do that. And in terms of advocacy, we need to figure out, then we have to talk to the parents, we have to talk to other people, but we need to figure out how we can get that voice in there, because that voice is not going to come easily. It's easier to talk to somebody who has language, even if they may have a mild intellectual disability and autism, let's say, but they have language, they can tell you, they can advocate for themselves. You can teach them to advocate for themselves. But for our adult children, they don't have the ability. Their disability prevents them from doing that. And we need to figure out how to have their voice in the room. And that's what I would say about advocacy.
Awesome, Doreen. Let's go ahead and pivot to the question and answer portion of our program. So going to Carola's question, did any of the presenters have access to early intervention services for their children? And Jackie, I believe that you did mention early intervention. Can you tell us a little bit about that? And then Doreen, the same question to you once she's completed.
Yeah, like I said, I noticed at 8 weeks old something was wrong. So I began trying to figure that out. And by the time my daughter was a year old, we had audiology and pathology and had discovered that she had no expressive or receptive language, but heard just fine. So we started early intervention at that point. We did have access. I lived up north at the time, and so I was in this kind of medical mecca. I had access to really great services, and I'm glad that question is asked, because I do see parents sometimes get asked or be told that so-and-so's grandfather's brother went in, early intervention, solved it all, and their child was speaking, as if the parent not accessing resources is why their child has autism. But I can tell you, in our case, we had access very early on to quality services, but though it helped tremendously, we do have access to her now. She is more sensory offensive than defensive. Her language has eventually emerged to minimal from nonverbal, certainly significant gains. But at the same time, we do still manage several challenges that have remained throughout her life. Yes.
And Doreen, what can you tell us about your experience?
Well, my son we didn't have early intervention. It's complicated, but he didn't have access to early intervention. But I do think early intervention could be very helpful. But I think here's the thing that Jackie said that's very, very important. Early intervention is great. It can help for some children who are more mildly disabled or more mildly delayed. We see complete catching up with their milestones, with early intervention. That's great. But there are people like our children who have disabilities where, you know, they're not gonna ever catch up, if you want to use that term. I don't really like that term, but you know what I mean. There, you know, my son's disability is a permanent disability. He was exposed to the rubella virus in utero. My son's adopted. By the way, please get vaccinated. Those vaccines were not available for rubella in those days, but they certainly are now. Those viruses can cause, you know, very severe disability, and that's where my son's disability comes from. So, but early intervention is helpful, and if you have access to it, and everybody should now these days, they should. All young children who have any kind of delay should have access to early intervention.
So let's move to our next question from the Q&A. Matty asks what they can do to best support caregivers. A little bit of context: they run a family and caregiver resource center, and they want to develop a wellness program for caregivers. What are the best supports that they can provide for caregivers?
Well, I would ask the caregivers. Frankly, I would get a group of caregivers together and ask them. Also, a little plug for the Catalight Family Wellbeing Scale. It's free. You can download it. You can use it if you have a group of parents. It's a way to track well-being for the entire family. But I would ask the caregivers what they need. And you know, respite is a big need lots of times. And one of the problems is getting a respite, somebody who's trained that can provide respite for children with profound autism or intellectual disability. But I would ask the caregivers. Jackie, what do you think?
Yeah, so we did survey families in Tennessee when we started the Tennessee chapter for NCSA, and the answers are kind of surprising. Even as a caregiver myself, of course, I related to the answers, but they wouldn't have been necessarily my first thought as a professional. But, you know, I'd say that number one answer that came back was homemaker services. A lot of parents, you know, even when we talk about respite, our children oftentimes take so long to develop a rapport and have such complex person-centered support plans that it is often difficult to feel safe to leave your child with somebody brand new, right? So if somebody is offering respite on an intermittent basis, then they may not have the rapport necessary for a parent to feel comfortable to leave their child with that person. However, if that person can come in and instead do some loads of laundry, you know, clean up the kitchen and reorganize things that they haven't been able to organize. Maybe they've got 3 loads of laundry sitting there that still need folded or whatever it might be. Just to take that day-to-day extra tasks that are piling up on that parent off of the parent so they can focus on their child could significantly reduce stress. An additional factor that families are really looking for support for is advocates for MCO meetings. Just like we have advocates for IEPs and we say, don't IEP alone, we're starting to say, don't MCO alone. The stress levels dealing with the MCOs, trying to battle for the types of care that they need for their child that is not fitting in the one-size-fits-all box of the MCOs, is so incredibly stressful for these families. So what they're looking for is support for those MCO meetings.
Okay, so next question that we have here in the Q&A is about the wider healthcare system. So I'm just going to rephrase Jamie's question just very slightly. So have you guys seen the healthcare system recognize and evolve to address complex medical needs for those with IDDs or with autism diagnoses?
You know, our medical system is fractured. It kind of depends on the system. You know, I practiced with Kaiser Permanente for 20 years, and I will say, you know, not everything is wonderful about Kaiser, but there's a lot of good things about Kaiser. And one of the good things is that we were all on the same system, right? All on the same system in terms of medical notes, right? Healthcare. So there was more coordination of care. I think that a lot of times families have care that is siloed, right? The neurologist can't see the notes from the pediatrician, and the pediatrician can't see the notes from the BCBA, and the BCBA can't see the note. It's all, and the psychologist can't see any of the notes, or whatever it happens to be. So we have a very siloed medical system, which I think for anybody with a disability and anybody with a chronic disease is difficult. If you have to take the x-rays yourself, to the pulmonologist from the hospital and deliver them yourself, that's the kind of thing that happens. And so I can't say I've seen, I think within some systems it might be better, but in terms of the entire country, we're in a very kind of fractured system. I will say this, the Affordable Care Act has been extremely helpful. The Affordable Care Act has given some protections. We need to strengthen that, in my opinion, strengthen the Affordable Care Act. But there are people and children that did not have good insurance. And it is state by state, because some states expanded their Medicaid and some did not. But we still have people who don't have good health care and good coverage. And I don't know exactly what the solution is for that, but I'd really like to see us as a nation address that for all people with disabilities and chronic disease, because there's a lot of us.
Yeah, absolutely.
And Jackie, I want to give you a chance to share any thoughts that you have on that. Have you seen the healthcare system evolve at all to better account for and accommodate those with complex needs?
So it has, and yet there is so far to go still, right? But when my daughter was very young, of course, there wasn't anything like complex care clinics available yet. But yet, by the time she was a teenager, that was extremely helpful in our lives and reduced an extraordinary amount of stress, being able to have her under the care of complex care at a regional hospital. But now that she's 21, she's aging out of that system. So that was very stressful. What are we going to do when she becomes an adult? Well, there was no equivalent like pediatric complex care in adulthood. However, right in the nick of time, as she was turning 21, Kramer Davis Clinic opened in Hermitage in Nashville, which is run by Dr. Matthew Holder, and he's a member of AADMD, and it is this integrated clinic, and they specialize in people with intellectual disability, ages 13 and up through adulthood, right? They are really focusing on the teens and adults who are aging out of pediatric care and still need specialized, holistic, integrated care for intellectual disabilities. And so that is outstanding, but that's one clinic, and well, actually, technically two. This is their second. They have one in Louisville too, but we need that in every city. Mm-hmm. Having access, period, to healthcare is very challenging when you have a significant intellectual disability as an adult. As Doreen mentioned, ages 22 to 64 is really harrowing. You have special education system, for better for worse, up until they're 22. And then you have geriatric care when they're 65 and up. But what do we do with that population 22 to 64? And we're just not talking enough about that. And research isn't going into that. Public policy isn't going into that. 22 to 64 is where I think we really need to course correct and pay a little more attention to in the healthcare field, in public policy, in research, all of it.
Okay, so this will probably be getting close to the end here on questions. So what is your opinion of virtual ABA services?
Well, that's kind of a complicated question. Do you want to go first, Jackie, or I can go?
Yeah, sure. I would say that at this stage of the game for me, I would be okay with virtual ABA on a consultative basis, 1 to 2 hours a week. As I said, 20 some years into this now, even in recent years when I would get a BCBA and they're like, what is it we're going to work on here, right? Because we had been in it so long. I don't need 40 hours of ABA, 20 hours of ABA, 10 hours of ABA. I don't need that. But what I do need is somebody in that capacity where I said they are collecting the data, they are helping me with the care coordination. They're helping as an advocate with my daughter. They're helping be an extra set of eyes onto me. I can't possibly catch everything, right? And I need another set of expert eyes in this situation to be able to see things that I'm missing, to be able to make recommendations I'm not thinking of at that time, just to make sure she has the best quality of life. And I would be totally okay with a couple hours a week of virtual. That would have been completely inappropriate 3 years ago, right? It really needs to be case specific and needs specific. I needed very high intensity, very high quality ABA when she was in the heat of those behaviors. And that was very challenging to find as well. So virtual is not an absolute substitute, and it really needs to be case specific, in my opinion.
Yeah, I think those are all really good points. What we find is if you're going to do more of a parent-mediated, like caregiver-led ABA, where you're coaching the parent and the parent is delivering the ABA, really what we do is we teach parents to change the way they parent. Not that they're sitting down for 2 hours doing ABA with their child. I don't think I wouldn't have done that. I don't think anybody's going to do that as a parent necessarily, but you're changing the way you parent by using ABA principles, behavioral principles, and strategies, interventions in your parenting. We have good results with virtual, with telehealth. A lot of times families are going to want more of a hybrid. You're going to do some in person. You're going to do some virtual. At Catalight, we want to make sure we have the right fit. If you're going to do, especially with a young child, if you're going to do paraprofessional mediated or tiered ABA where you have an RBT or another paraprofessional, you can't do that with a young child. You don't want a young child sitting in front of a screen. It doesn't make any sense anyway. You really need to do that in person. We do have, for those without intellectual disability who are autistic, who are youth or adults, you can do coaching with a BCBA, doing virtual coaching with that person, really teaching them to observe their own behavior, teaching them some behavioral techniques they can use for themselves. We can all use that. I could use that myself. But, there is, I think, post-COVID, we have found different ways that telehealth or virtual can really work. But to say that you're just going to do everything virtual, I don't think that's realistic, and it's not going to meet the needs. It just depends on what the needs are of that child and family.
Okay, so the last thing I'm going to say from the Q&A, there was a question about resources and their availability. You can click into the resources tab right now and download those available resources. That includes access to a podcast information sheet, as well as the survey I mentioned at the top. You'll also be able to get access to those resources in the replay link that'll be available once we wrap this up. And we're going to do that now. I want to thank everyone for joining us today. I want to give a special thanks to Catalight's Chief Clinical Officer, Doreen Samelson, Jackie Kancir, Executive Director of the National Council on Severe Autism, for partnering with us on this essential topic of profound autism. And of course, big thank you to Catalight for sponsoring and developing this conversation as well. Again, remember to download anything that you need from the webinar platform. Take just 1 minute to share your experiences with us based on today's webinar. Your feedback is essential to helping us improve in the future. Also, registrants will get a replay link sent to them. I'm Chris Larson, and we'll see you next time.